air emissions, those types of things. There's lots of ways that businesses can impact the environment, and that's all kind of to do with their ongoing operational exposure. But there's also a legacy risk as well that businesses have as a result of what they may have done at that location historically, or even what the site may have been prior to them occupying the site.
Welcome to the Anatomy of Risk, a podcast series dedicated to exploring the critical intersections of risk management, insurance, and the ever-evolving health and social care sector. Our goal is to arm you with the knowledge and tools you need to mitigate risk effectively, ensuring you can focus on what you do best, providing excellent care. Welcome to the Anatomy of Risk podcast. I'm your host, Rachel Phillips, Health and Social Care Leader at Willis, a global risk and insurance consultancy, providing data-driven, insight-led solutions for health and social care providers in the areas of risk, people and capital. I have with me today Chris Strong from Willis's specialist environmental team to discuss environmental risk within the health and social care sector. Chris leads our environmental practice and has worked in the environmental insurance market for the past 20 years, prior to which he worked as an environmental consultant. The Willis UK environmental practice is a team of 4 specialists dedicated to placing environmental risks across multiple sectors. Chris, it's really good to have you with me. Welcome.
Thank you.
I guess to start off, Chris, to set the scene, we're all aware that environmental incidents can have quite a significant impact on organisations, and whether that's regulatory scrutiny and compliance, substantial financial costs, of course, involved in clean-up expenses, legal fees and fines, or operational disruption, plus, of course, reputational damage. And standard public liability insurance policies have some limited protection for sudden and unintended incidents, but not for gradual or historic pollution. It's a subject actually which is not often discussed in the context of health and social care. So, Chris, what are the primary drivers of environmental risk for UK health and social care providers?
Well, I guess there's lots of drivers really, and I think when we think about the sudden accidental coverage that most providers will have on their general liability policy, and we often point out the difference between the gradual and the sudden accidental, but one of the main things to point out is that if you do have any kind of environmental incident at a location, your general liability policy generally only covers those third-party off-site cleanup costs. So an environmental insurance policy is aimed at covering both the off-site and the first-party on-site cleanup costs as well. So there's lots of gaps in existing coverage that environmental policies are aimed at covering. And I guess the primary drivers as to why clients within this sector should be thinking about environmental risks, or what the drivers are, there's several really. And if we think about it from kind of 2 different angles, there's the ongoing operational risk, like you mentioned before. There's lots of different ways that a business can actively pollute the environment, whether it's discharging waste effluent or poor raw material storage, or any kind of air emissions, those types of things. There's lots of ways that businesses can impact the environment, and that's all kind of to do with their ongoing operational exposure. But there's also a legacy risk as well that businesses have as a result of what they may have done at that location historically, or even what the site may have been prior to them occupying the site, which as landowners they're then liable for. So there's 2 main kind of ways in which you can come at environmental risks, and within those there's lots of different nuances.
That's interesting. I guess mould also could potentially be a challenge. I'm just thinking about care home groups, but even in, I guess, hospitals and clinics, there could be the potential for that. Does that sort of feature?
Definitely so. We've seen in various other territories, mould is a huge issue. And if you think about the way mould manifests itself, it's not a sudden and accidental type of pollutant. It's a gradual thing that builds up over time, and it's as a result of either poor ventilation or aging infrastructure, or any kind of damp or leakage into the building. And these things can be incredibly expensive to clean up. You have to often rip out the whole kind of
Mm.
drywall building internal structure of the building and then replace it. But also that type of cleanup costs of replacing the building fabric, but also the potential bodily injury risks as well.
Yeah.
You can have tenants who, or third parties who can make claims against you as the owner of the site for health issues as well. And there's been lots of claims in the US, particularly for indoor air quality relating to mold issues.
Yes, and I guess when you're thinking about, the UK health and care sector, there's a lot of aging property. One of the biggest challenges,
Yes,
particularly for some of the hospitals, but perhaps not so much in the private sector as you would get in the NHS maybe, but certainly there's the opportunity for this to happen. And as you say, very injurious to health and for the service users and employees.
exactly that, and it's not just mold. There's other airborne diseases like Legionnaires that
Hmm.
if you're on a huge kind of shared water system, it needs to be well managed. Especially in aging infrastructure in this country, asbestos is something to be concerned about, especially if you have a lot of contractors working on the building, which you often do at health facilities.
Mm.
It's very easy to inadvertently disturb asbestos, even though the
Yes,
mere presence of asbestos is often okay. It's not okay if that's disturbed and released into the environment. So,
of course.
yeah, indoor air quality, whether it's mold, Legionnaires, asbestos, needs to be closely managed.
Yeah, that's interesting, Chris. And I guess you mentioned that in terms of in the US. Are there any other lessons we can learn from countries like the US in terms of either incidents that can arise or potential costs that are associated with that?
Yeah, definitely. I mean, in the US at the moment, there's a big issue with various medical sterilization plants where these facilities use a gas called ethylene oxide to sterilize surgical equipment and medical equipment, essentially. And if these gases are not controlled properly or not managed properly, they're easily released into the environment, and historically have been just released directly into the environment. And it's been shown that there's a potential link with ingesting ethylene oxide and cancer. And
Right.
there's several medical sterilization facilities in the US that have had large class action claims against them for alleged health impacts on the neighbouring residents, and the cost of that has been ginormous. I think there was one facility last year that I think the legal defence costs were around $90 million, and the final compensation payments were over $750 million, I think. So
Gosh, right.
we're not talking small change here. This is huge. And whilst I don't think we have a huge use of ethylene oxide in the UK,
Mm, correct.
it's certainly really important to consider what potential other air emissions are discharged as part of a health sector use, and how potentially they could impact human health.
Yeah, well, thank you. That's interesting to hear. And as you say, whilst it's typically a steam sterilisation, I think largely in the UK, although not
Yeah.
solely, it's worth just pointing out these different over time, different sterilisation practices can come into effect, and it's worth just understanding that. And actually, more just from the pure quantum of how these things can sort of play out in terms of the residents or neighbours. So thank you for sharing that. If a health and social care provider is listening right now, which hopefully some will be, what practical steps can they take, firstly, to comfort themselves that they've captured all potential environmental risks?
I think, like we started off, there's two ways of looking at environmental risk. There's the historical risk that you take on as owner of a property, and then there's the ongoing operational risk. If we look at the historical risk of a facility, then often, sites are bought and sold, or portfolios of businesses are bought and sold, and as part of that transaction, you take on more often than not that historical liability. And what's really important when you're undertaking these transactions is to undertake proper environmental due diligence, and that involves employing an environmental consultant to look at the portfolio as a whole, undertaking an environmental desk study, which essentially looks at available kind of online information, historical maps, pollution incidents in the past, and builds up a picture of how these sites kind of may pose a threat to the environment going forwards by looking at their historical use. So I'd say proper due diligence at the point of any kind of purchase or divestment. If we're looking at the ongoing environmental risks that facilities provide, it's really having a robust environmental management plan in place. And, you know, even individual locations can cause significant damage to the environment if things aren't managed properly. So you may have an in-house environmental health and safety person that can do this, or you can, you know, employ contractors, consultants to help you along with that. But essentially that's ensuring that all the correct environmental permits are in place, ensuring that fuel and chemical storage is appropriate, all of your chemical inventory is listed as it needs to be. Things are monitored as they're supposed to be, whether that's air emissions, surface water discharges. All of these types of things form part of an environmental management plan, and it's making sure that's robust enough to try and limit as much as possible the environmental risk. You're not going to completely eradicate environmental risk, but you can minimize it as much as possible.
Thank you. And in terms of capturing, so they've captured all the potential environmental risks. What can a provider do to assure they've taken all necessary action, I guess, to mitigate, reduce, or remove the risk? Because to your point, perhaps you can't fully remove the risk, but in terms of that mitigation and that reduction, is there anything practically we can share with them to help with that?
There's kind of physical measures that you can put in place with regards to, say, surface water discharges. There's certain valves that you can have in drainage systems in the event of an emergency that shuts off discharges to, say, surface water systems. But really it's having that environmental management plan and a spill response plan in place that ensures that when an incident does occur, the correct people are contacted and the kind of the right process is put into place, whether that's contacting the Environment Agency, contacting the local neighbours to potentially they may need to be evacuated in a worst case scenario, or close their windows, that type of thing, just to kind of limit both the environmental impacts but also the reputational impacts of the business.
So really manage this risk as you would any other risk as part of your sort of overarching plan to manage risk. That's what I'm hearing. But there's some very specific things, as you said, around due diligence and around certain areas of potential spill, for example. But I guess also it's around that emergency response, which you've also touched upon there, Chris. So, you know, as part of your incident response preparedness to make sure that this is captured, and as you say, the people that would need to be contacted and the efforts that would need to be made are included in that for environment as with every other risk.
Yeah, exactly. I think that's where environmental insurance comes into play as well. It kind of covers that gap with regards to you have the appropriate environmental management systems in place, but when an incident does occur, it gives you the tools to respond to an incident quickly and swiftly, and therefore limit the costs and also have those costs covered as well.
Thank you. And are there any particular heads of cover? We've talked briefly earlier about the fact that this provides cover for those incidents that are gradual and potentially more historic in nature, and cover liability to third parties. Are there any other particular heads of cover under a standalone environmental impairment liability insurance that you would want to just raise now, Chris, for the audience?
Yeah, definitely. I think one of the main heads of cover, and it's probably going to become increasingly important as time goes on, is biodiversity damage. And that protects and provides cleanup costs and restoration costs to any damage to protected species or areas of outstanding natural beauty or any kind of conservation area, or any loss of flora or fauna. So if there's, you know, a significant discharge into a river that causes a large amount of fish kills, and potentially these fish are protected species, then it pays for the potential restoration costs for that. So that's one important head of cover. I think another one is loss mitigation costs. So if you think about traditional policies, they respond after the incident has occurred. Often with environmental incidents, you can almost predict that an incident may occur, and therefore the policy can respond to prevent it happening. For example, say there's a fire at a facility and the fire brigade come along and pour lots of firefighting foam, which in itself is very hazardous, but also it can wash away lots of contamination from the site. Your site has a surface water drainage system that drains directly into a river. What the policy will do is pay to pump that contaminated water runoff into tankers and store it somewhere else before it gets into the drainage system and pollutes the environment.
Excellent, thank you. That's really helpful. So one, I guess, key takeaways for me from our discussion, Chris, is that health and social care providers clearly do have environmental considerations and no doubt are already looking at these. And those considerations, if an incident occurs, could lead to significant costs, regulatory scrutiny, as we touched upon, and reputational harm. And many probably will be relying solely on their public liability for limited or indeed arguably no protection in certain circumstances. So providers should certainly regularly review this area of risk, as you've touched upon, and as part of their management of it, consider standalone environmental impairment liability cover where they feel exposed to residual risk. Would that be fair? Yeah,
very fair. I think it's quite a simple process to put coverage in place, and definitely it's very simple to get quotes to understand what the potential costs are for this, and it's definitely worth exploring because there are gaps in traditional insurance policies, whether that's property, general liability, or anything else really, and environmental policies are really designed to fill those gaps, and those gaps are only going to broaden as environmental legislation broadens.
Of course, and I would probably hazard a guess that many health and social care providers don't really have this on their radar in the same way as other risks, and they possibly aren't aware of the limitations of their current covers as well around public liability, but I may be wrong, but that would be my guess, having spoken to many of them.
Yeah, I definitely agree with that. I think if you look at the US, it's widely bought by the sector, but yeah, elsewhere I think it's less known about.
Well, thank you. Well, hopefully after today, it's more known about with the providers that listen in. So, Chris, thank you. It's been a pleasure chatting with you today on the anatomy of risk.
Thank you very much. I've really enjoyed it.
Thank you. Thanks, Chris. And thank you for listening to this podcast from Willis, a WTW business. The information in this podcast is believed to be accurate at the date of publication. This information may have subsequently changed or have been superseded and should not be relied upon to be accurate or suitable after this date. This podcast offers a general overview of its subject matter. It does not necessarily address every aspect of its subject or every product available in the market. It is not intended to be, and should not be, used to replace specific advice relating to individual situations. We do not offer, and they should not be seen as, legal, accounting or tax advice. If you intend to take action or make any decision on the basis of the content of this publication, you should first seek specific advice from an appropriate professional. Some of the information in this publication may be compiled from third-party sources we consider to be reliable. However, we do not guarantee and are not responsible for the accuracy of such. The views expressed are not necessarily those of Willis Towers Watson. For further authorization and regulatory details about our Willis Towers Watson legal entities operating in your country, please refer to our Willis Towers Watson website. It is a regulatory requirement for us to consider our local licensing requirements.